Hi, and welcome to Society's Secrets with me, Samantha Kennedy. Here, I give you the scoop on what is actually going on every day around you, while you go on living unaware that these issues even exist. Today, we delve into the world of chlamydia, a dangerous STD sweeping over the world. But the question is, what really is chlamydia? And is it really that much of a threat? Let's start with what chlamydia actually is. Chlamydia is an STI, sexually transmitted infection, otherwise known as an STD, sexually transmitted disease, that affects both men and women. It is not only a potentially life altering STD, but also the most common in the nation. This STD is caused by a bacteria known as chlamydia trachomatis. This bacterium causes a chlamydia infection once it has passed to a person. Chlamydia is most commonly passed during sex. Contrary to stipulations, this disease can be passed during any type of sex, whether it is vaginal, anal, or oral. Even if the man does not ejaculate during sex, the bacteria may still be passed. This disease can also be passed during birth from a mother to her baby. No matter what, this disease is life-altering and extremely dangerous if it goes untreated, which occurs much too frequently. In women, the bacterium first attacks the cervix or urethra. The infection then spreads through the uterus and the fallopian tubes. For testing, women will be tested in the cervix and men in the urethra. But should you be getting tested? If you have any symptoms of chlamydia, see your doctor immediately. Symptoms in women include vaginal discharge that is abnormal, pain when using the bathroom, nausea, back pain, bleeding in between periods, and pain during sex. A fever may also occur. In men, symptoms of chlamydia infection include discharge from the penis, pain and swelling around testicles, burning while urinating, and burning or itching around the opening in the penis. These symptoms occur about 1 to 3 weeks after infection. But this disease is very sneaky. Chlamydia is known as a silent infection, meaning that there are often no symptoms to warn you that your body contains the disease. Only 50% of infected women and 75% of infected men will show symptoms of chlamydia. If you have multiple sex partners, or if your partner has multiple sex partners, you should get tested due to the risk of silent infection. Testing varies, but as mentioned earlier, it may involve swabbing from the cervix or vagina in women and urethra in men, or testing of urine samples. These samples are then taken to a lab to be analyzed for the trace of the bacteria. If discovered that you have chlamydia, it can be easily treated and cured, most commonly with an oral antibiotic. Common antibiotics to treat chlamydia include azithromycin or doxycycline. If you go without treatment for chlamydia, many dangerous health problems may occur that will alter your life. To truly get a feel for some of the life-shattering effects, let's go talk to Jessica Lopez, a 28-year-old victim of chlamydia. Welcome, Jessica. Thanks so much for joining us.
No problem, Sam. I really just want to raise awareness so that young teenagers don't make the same mistakes that I did.
Of course. Now, could you please tell our viewers your tragic story of how chlamydia has altered your life?
Well, when I was about 15 years old, a sophomore in high school, I became sexually active. At the time, I wasn't really thinking about the consequences of what I was doing. Health class was like a free period for me, and I chose to neglect the warnings of STDs and pregnancy. It wasn't until my friend got pregnant at 17 that I realized that I needed to care for myself. I thought I was fine, but 2 years ago, I married my wonderful husband, John. We decided to try for a child about 5 months into the marriage. Numerous attempts failed, so we decided that it was time to go see a doctor. My doctor then told me that I had chlamydia and it had scarred my fallopian tubes, therefore making it impossible for me to have my own children.
What was it like for you and your husband to find out that you were indeed infertile?
It was shattering. Since I was a young girl, I dreamed of having a family of my own, but that dream was crushed. I know that I'll never be able to bear a child of my own. Currently, John and I are looking into adoption, but it's still hard to know that this STD has changed my life.
Thanks so much, Jessica, for sharing your story. Is there anything that you would like to tell our viewers, especially the young ones that may be making the same mistakes as you did?
Don't have sex as a teenager. Save it for someone you love. Your body is a sacred place, and you don't want to have effects that will be with you for the rest of your life.
If you haven't already heard, 1 in 15 sexually active teenagers between the ages of 14 and 19 will contract the chlamydia infection. Other effects include PID, pelvic inflammatory disease, tubal pregnancy, which is when the egg implants outside the uterus, inflammation of the bladder, known as cystitis, and a risk of HIV and AIDS. 1 in 5 women that have untreated chlamydia will get HIV. For men, health problems include infertility, scarring or infection of the urethra, or infection of the tube that carries sperm from the testes. Babies are also at risk if the mother has chlamydia. During childbirth, they may get an eye infection known as conjunctivitis or pink eye, which shows about 10 days after birth and can potentially lead to blindness. Also, pneumonia may occur, which is extremely dangerous to babies. In breaking news, in school this year, there's been a case of what is called criminal chlamydia at Old Miss. One man, who was not caught, attacked and left a large group of victims with itchy and uncomfortable symptoms. Luckily, chlamydia, when caught, can be treated. For more info, check out the article by Joshua Barnett. Here is the link. The best way to prevent chlamydia is not to have any type of sex. Also, always use condom properly during sex. Have only one sex partner that is not infected, and get tested regularly for STIs. Birth controls will not protect you from chlamydia. Chlamydia is a very dangerous STD that occurs much too often in today's society. It's up to you to stop the disease. That's all for today on Society's Secrets. Tune in next week for more of the truth about what's going on around you. Bye.